For us, it starts with the needs of our customers, so the NHS. The NHS has really ambitious goals to achieve net zero by 2045. So as a supplier to the NHS, we've got a lot of programs in place around sustainability. For example, how we design our products, how we deliver our products, for example, using hydrogenated vegetable oils, that's like a 90% reduction in carbon, how we service our products. It could also be biodiversity projects that our staff do in and around the NHS trust areas. Social mobility is also another big theme for the NHS. I'm really proud we partnered with University, an award-winning charity across the UK. They've got 43 locations. So some of our social mobility work is done with University, but there's many other examples at Roche. I think health inequalities is another big issue for the NHS, and we've got a number of targeted health inequality programs that we have at Roche. So I think there are kind of three examples of how we work in action to support social value and our customer. We chose Social Value Portal as a customer because of the range of the capabilities that exist in the Social Value Portal and the breadth of your offerings. So from strategy consulting to the measurement system to the metrics as well, and just the general advice and support that we knew you'd be able to give us. Your culture as well, you're very kind of easy to work with as an organization, as a very busy corporate industrial organization. Having partners that we can work with and are easy to work with really helps. And in terms of how working with the Social Value Portal has helped us at Roche, I think from the strategy perspective, we've got a really coherent strategy on social value. You've helped upskill a number of our staff as well. You've helped us a lot on the measurement side, so uploading our customer commitments onto the portal and really understanding the elements of measurement as well. So I think that's been really important. I think the great thing is the feedback we've had from the market in the last 2 years since we started the journey is that, we're real market leaders. Our ambition is to be the leader in social value in the healthcare industry, and that's the signals that we're getting back from the industry. So I think it's a great position for us to be in. The weighting in tenders is a minimum 10% in the healthcare industry for social value. Sometimes it's 15%, there's talk about being 20%. So when we submit a bid, we commit over 10 to 15 years over the contract period to deliver social value for that customer. So the way we integrate social value into our business, a part of it is based on our commitments to customers. So setting up the projects and initiatives for our customers over those timelines. We also do a lot of social value as a business as well. So whether that's the environmental programs that we have, it might be working with our supply chains, working with the procurement partners, getting our staff excited about volunteering in their local communities. So there's many different ways in which we integrate it into our business. But a key part is supporting our customers and the commitments that we've made to the NHS. My advice to companies who are thinking about getting started in social value is not to overthink it. I think there's a lot of great resources on the Social Value Portal, so you can get up to speed very quickly what social value is about. You'll already, as an organization, be delivering a lot of social value. You'll probably be employing local people, your staff will be volunteering, you'll be making charity donations, etc. So realize you're already delivering social value and just figure out how much social value you're actually delivering today. I think as well, just go and talk to local organizations, so local DCSEs in your areas. Listen to what their issues and challenges are and try to figure out just what action you can take now to help and support those organizations. And I think that's a great way to get you on your journey. I think one of the things we do at Roche with social value is we make videos of practically everything we're doing and we play it back in our corporate office so that people, when they're queuing to get a coffee, there's a big screen and they can see everything that their colleagues are doing to deliver social value. So you get that really positive effect happening. So start small, get things moving, don't overthink it. And I could ask the question, when is the right time to start a social value project? 20 years ago, right? So what that means is just get moving, don't overthink it, and start making an impact. So what's next for One Roche and Social Value is our Social Value Pledge. So we're the first healthcare company in the UK to make a big, bold £200 million pledge in terms of social value we'll deliver. So I'm really proud that we've made that pledge. So we'll be working hard to deliver that. Achieving net zero by 2045. In fact, we're going to go further than that. So we're going to deliver net zero by 2045. We're going to deliver real zero by 2050. So again, very, very ambitious. So we're going to be working on that. Health inequalities. So there's so many health inequalities that we have in the UK. So that's going to become a core focus for us at Roche and helping to tackle health inequalities to support the NHS and reduce pressures on the NHS. And we have so many suppliers, so the next level is to actually educate our supply base, but also amplify social value across our supply chain. So it's not just Roche, it's Roche and our partners so that we can maximise the impact we're making in the UK.